Hello everyone, here is Medicine Health 360 channel. It is your best friend to promote your health in daily life. Today, the topic is about sleep position, which is related to your health or disease conditions. You do it every day. What is the best sleeping position? What position makes you wake up more tired? What is the most dangerous position? What are better positions for especially patients with heart disease, with lung diseases? We first give you the famous stories, then talk about the physiological and medical reasons. At the end, I'll cover special considerations for people with heart disease and lung disease. Popular stories, common wisdom. Many people say that sleeping on the side, especially the left side, is the best sleep position for general health. For example, one popular article says side sleeping is often best for back pain and sleep apnea. Conversely, sleeping on your stomach is often viewed as the worst. It may feel comfortable for some, but many experts warn it puts strain on the neck, back, and can wake you up feeling stiff. Sleeping on your back, supine, is sometimes promoted, especially for spinal alignment, but many articles say it may lead to snoring, airway obstruction, and thus poorer sleep for many people. For people with particular conditions, heart failure, breathing difficulties, acid reflux, there are best positions and ones to avoid circulated in health media. E.g., sleeping on the right side may be best for heart failure, while left side is often recommended for pregnant women or those with acid reflux. Some sources call back sleeping the least healthy overall sleep position for adults because of airway obstruction worries. Famous stories and historical anecdotes about sleeping positions. Throughout history, sleeping positions have been tied to cultural beliefs, health advice from ancient physicians, and even myths that persist today. Here are some notable examples. Ancient Rome and the right side. Preference in Roman culture, sleeping on the right side was considered beneficial for health and digestion. This belief stemmed from the idea that it aligned with the body's natural flow, avoiding pressure on the liver, which was thought to be on the right. Famous physician Galen, who practiced in Rome during the 2nd century AD, advised positions that promoted relaxation and avoided strain, influencing Roman sleeping habits. Ancient Greece and balanced rest. Greek physicians like Galen, who bridged Greek and Roman medicine, emphasized sleeping positions that maintained bodily harmony. They recommended side sleeping to aid in the retreat of blood to the abdomen for warming during rest, a concept tied to humoral theory where balance of bodily fluids was key to health. The Greeks used a cline, a couch bed, for lounging and sleeping, often in semi-reclined positions during the day. Medieval two sleeps and position shifts. In medieval Europe, people often practiced biphasic sleep, waking after a first sleep around midnight for activities like prayer or conversation, then returning for a second sleep. Positions weren't strictly documented, but historical accounts suggest shifting sides or propping up to stay warm in drafty homes. One quirky anecdote involves the misconception that shorter medieval beds meant people slept sitting up. In reality, beds were shorter due to design, but people lay flat, sometimes with bolsters for elevation. Benjamin Franklin and John Adams sharing a bed. During the American Revolution, founding fathers Benjamin Franklin and John Adams famously shared a bed while traveling in 1776. Accounts describe them debating window positions for fresh air, with Franklin advocating open windows regardless of sleeping posture. This highlights colonial-era bed-sharing customs among travelers, where side-by-side positions were common due to limited space. These stories reflect how sleeping positions were influenced by cultural, medical, and practical factors long before modern science. Famous stories and cultural beliefs. Across history and different cultures, beliefs about the best sleeping position were often linked to spirituality, anatomy, and practical living. Ancient Greco-Roman tradition, right side, influenced by the Hippocratic school of medicine and later physicians like Galen, sleeping on the right side was often recommended. It was believed to aid digestion, as the stomach's anatomy allowed food to pass more easily from the esophagus when lying in this position. Traditional Chinese medicine, back north, the practice of feng shui recommended sleeping with the head pointed north and the body flat on the back, supine position. This was believed to align the body with the Earth's magnetic field and promote the free flow of qi, life energy, ensuring stability and grounding. Ancient Egypt, side north-south. Similar to the Chinese, ancient Egyptians often aligned their beds in a north-south direction, with the head facing north. Mummies in tombs are frequently found lying on their sides, suggesting a cultural preference for the lateral position during sleep, which was seen as a state of balance and harmony. Famous stories and cultural sleep habits. Napoleon Bonaparte reportedly slept on his stomach, which may have worsened his chronic stomach issues. Leonardo da Vinci practiced polyphasic sleep, taking short naps throughout the day, often curled in a fetal position. Queen Elizabeth I preferred sleeping upright to maintain her elaborate hairstyles, though this likely disrupted her sleep quality. Pregnant women are advised to sleep on their left side to improve circulation to the fetus, a practice backed by modern obstetrics. Physiological and medical reasons. Here are reasons behind what we hear and what experts recommend, broken down by position, then special populations. Side sleeping, lateral position, why it's often good. Sleeping on your side reduces gravitational collapse of the airway, tongue, soft tissues, compared to back sleeping, helping reduce snoring and obstructive sleep apnea, OSA. It helps with digestion and acid reflux, because the stomach is lower than the esophagus when on the left side. This reduces backflow of acid. For spinal alignment, side sleeping with knees slightly bent and a pillow between knees may relieve back-hip stress. Possible downsides. If the body is curled too tightly, fetal position, there may be strain on shoulders, hips, or even restricted breathing because of diaphragm compression. On one side only may lead to shoulder-hip pain if that side is under pressure for long. Some data suggest left side sleeping may, in certain heart or lung conditions, increase pressure on organs or exacerbate symptoms. Back sleeping, supine. Why it might help. If your spine and neck are supported well, pillow towel under knees. Back sleeping can be neutral for spinal alignment and relieve lower back pain. It avoids twisting the neck for breathing and can reduce joint pressure in certain cases. Why it may make you wake up more tired, be a worse choice in many cases. In back sleeping, the tongue and soft palate may fall backward under gravity, narrowing the airway and worsening snoring or obstructive sleep apnea. It can worsen gastroesophageal reflux, GERD, because stomach acid can flow more easily upward when lying flat. For people with breathing issues or sleep apnea, back sleeping may lead to more disrupted sleep and thus waking up more tired. Stomach sleeping, prone. Why some people choose it, can reduce snoring for some because airway is open in a face-down posture, though that may be offset by other issues. Why it's often considered the most dangerous or least desirable. Forces neck rotation to turn head sideways and may put spine in an unnatural position. This leads to neck, back pain, stiffness. The spine's natural curves may be flattened or twisted, increasing mechanical stress on vertebrae and discs. For breathing, respiration, face down may restrict chest expansion and in some cases compress internal organs or restrict diaphragm movement. Overall risk for waking up with pain, fatigue, and reduced sleep quality is higher. Because of these risks, many experts list stomach sleeping as least recommended for many adults. Special considerations: heart disease and lung disease. Heart disease, including heart failure. In people with heart failure or compromised cardiac output, lying flat on the back may increase blood return to the heart and lungs, which may worsen shortness of breath, orthopnea, and lead to more disturbed sleep. Some studies suggest people with heart failure feel more comfortable sleeping on their right side rather than the left side or straight on the back. On the right side, the heart may be under less direct mechanical pressure. Also, the inferior vena cava, which returns blood to the heart, is less compressed compared to lying on the left. For heart patients with arrhythmias or palpitations, sleeping on the left side might increase awareness of heartbeat because the heart is closer to the chest wall on that side. Therefore, for heart disease patients, side sleeping, especially right side, is often advisable. Back sleeping may be tolerated if no sleep apnea, but flat supine might worsen breathing and fluid redistribution to lungs. Lung disease, COPD, obstructive lung disease, unilateral lung issues. In lung disease, especially one-sided lung problems, a concept called trypopnea refers to shortness of breath when lying on one side due to perfusion and ventilation mismatch. Patients may prefer lying with the healthy lung downwards, so the healthy lung is better perfused, or on their unaffected side up. For obstructive sleep apnea or OSA and airway issues, which may overlap with lung disease, side sleeping reduces airway obstruction and improves ventilation compared to back sleeping. Elevating the head or upper body can also assist breathing by reducing compression of airway and facilitating lung expansion. Therefore, for lung disease patients, side sleeping, on the good side if one lung is diseased, and partial elevation of the upper body offer better breathing and less waking up tired. Summary: best, worst, and wake up more tired positions. Best general position for many adults, side sleeping, especially left or right side depending on comfort, with proper pillow support and knees slightly bent. This offers good alignment, reduced airway obstruction, better digestion, and lower back relief. Worst position in many cases: stomach, prone sleeping, highest risk for neck, back pain, awkward alignment, likely waking with stiffness and possibly discomfort. Also, back sleeping, supine, may be worst for people with sleep apnea or breathing issues. Position that may make you wake up more tired: back sleeping for those with snoring, obstructive sleep apnea, or breathing heart conditions, because reduced airway, more breathing disruptions, addiction, lower sleep quality. Also, stomach sleeping due to pain, discomfort, may wake you up fatigued. Position that may be most dangerous: for certain populations, back sleeping, supine, may worsen airway collapse, leading to OSA, heart stress, and stomach sleeping may cause spine/neck injury. For heart-lung patients specifically, supine or left side may be dangerous depending on condition. For example, in severe heart failure, left side or flat supine may worsen orthopnea. Practical tips and takeaways: aim for side sleeping, left or right, with good pillow support, head, neck, between knees, to maintain spinal alignment and minimize strain. Avoid sleeping face down if possible. Try to transition gradually, e.g. use pillows to discourage stomach sleeping. If you sleep on your back and snore, wake up tired, or have breathing/heart issues, try switching to side or elevating the head of the bed, wedge pillow. For heart disease, consider sleeping on the right side. Avoid flat supine if you have orthopnea. Use head elevation. For lung disease, side sleep on the better lung side or healthy side down. Elevate head if needed. Avoid lying flat for prolonged time. Ensure mattress and pillows support your posture. Not too soft. Keep spine neutral. If you have sleep apnea, obesity, heart failure, or chronic lung disease, consult a clinician for tailored sleep position advice, as individual factors matter a lot.